Greetings and welcome to Montgomery Heart Wellness. I'm coming on for a short period. I just got news, really an update on the news about Madonna. I did hear about it yesterday. I did want to come on. There wasn't much out. Thankfully, she is doing better. I want to talk to you about the issues related to her clinical case and give you some insights in terms of what's reported and what it might mean. We're not going to be on for very long, so let's get right on it. Here's the story. Madonna suffered a bacterial infection and which landed her in the ICU. And she reportedly was intubated. I'm going to explain what that is for at least over the night, and the tube was removed. Now, this was happening during her time preparing for a tour. The report was that the pop star is alert and responding and no longer in the ICU. So apparently she was found unresponsive, either at a hotel or where she was staying. Apparently was given immediate medical attention, intubated and taken to the ICU. It's reported on Saturday, June 24th, Madonna developed a serious bacterial infection which led to a several-day stay in the ICU. Her health is improving. However, she is still under medical care. A full recovery is expected. So what does it mean to have a bacterial infection, and why would that lead to being unresponsive? And what I want to do is share with you some information about bacterial infections, the condition known as sepsis syndrome, and the like. But before we get to that, I want you to, if you are new to this channel, subscribe, give us a thumbs up. If you get a lot out of this, pass this on, share this with many friends or loved ones. I think you're going to get a lot of information from this. So first and foremost, let me go and share my slide here. I want to share some information about the condition of sepsis, bacterial infection, and the like. And I think it's going to be important for you to understand, what does it mean to have a bacterial infection? How can a bacterial infection cause you to become unresponsive? What do we do in the ICU? What are some of the things that we try to do in the ICU to help you out in case you are very ill? So let me go to my screen here. My computer's not acting right. There we go. So Madonna unresponsive and later intubated in the ICU. So how do you get a bacterial infection? Many people get bacterial infections a lot. They have a toothache. You may have bacterial infection, a stomach ache. Sometimes you get a skin wound. So you get an infection. How does that lead to unresponsiveness? It's really important to understand that the body works as a system. So there's a condition known as sepsis. And sepsis is, we consider it a syndrome when you have an overwhelming infection throughout the body. So bacteria may start, let's say, with a toothache, or may get a bacteria crosses the lining of the GI tract, say a stomach infection, or a bladder infection, or a skin infection. Typically, if you have an isolated infection, it stays in that location, maybe in the tooth, maybe in the stomach. However, sometimes bacteria can break through the barrier of the blood vessels and spread throughout your body. And then it becomes a systemic infection. So an infection that starts in your mouth as a toothache or tooth infection can spread throughout your blood system and affect your whole body. So what are some of the symptoms that someone may feel if you're getting a systemic infection? Now, usually these symptoms of a systemic infection is related to your immune system's response. But one of the symptoms are chills. You may have a sense of confusion or delirium. Now, if the infection becomes so overwhelming, it can cause chills, delirium, confusion, and you can get it to the point of being unresponsive. That probably explains what happened with Madonna. Oftentimes you have fever, your body's working to fight the infection. You can have lightheadedness, which in this situation, you may have low blood pressure, and that lightheadedness may be due to low blood pressure. A rapid heartbeat, again, related to low blood pressure and rapid heartbeat due to fluid leaking from outside the blood vessels. Skin rash, mottled skin, that's probably due to poor perfusion, skin being warm. So these are the symptoms that someone may feel if they have a bacterial infection that's progressing to sepsis. However, what are some of the clinical signs? So if you come into the hospital, I'm in the emergency room, or maybe I'm your doctor in the ICU or CCU, and we take vital signs, we do a clinical assessment. What are the types of things we may see in someone who has sepsis? Well, we may notice that the blood pressure is low. Yesterday in the office, we were seeing patients. I was notified that someone in our nutrition center and restaurant adjacent to us was passing out or nearly passed out. So we rushed her aid, we laid her down, and her blood pressure, systolic blood pressure, was 85. She was clearly hypotensive. Poor circulation in critical organs. These organs may be the kidney, that could lead to kidney failure. It could be the liver, that can lead to liver failure, which results in poor enzyme production, poor protein production. Brain could be affected. This is why someone may be unresponsive. So you say, well, how can someone have bacterial infection and become unresponsive? Well, if the bacterial infection starts to spread throughout the body's bloodstream, then the body immune system starts to kick in, and all of these systemic reactions start to occur. The heart can start to be weakened due to poor heart functioning, and that can lead to heart failure. A systemic infection can result in the buildup of acid in the blood, and this in turn triggers a lot of the other things I mentioned above, such as heart failure, adverse brain effects, increased amount of inflammation. Inflammation can be systemic, and it can cause a dysregulation of the immune system throughout the body. That's what contributes to low blood pressure, fast heart rate. Protein, albumin leaks out of the capillaries, so the protein levels go low. You start to swell. Your lungs start to swell. That's a condition known as ARDS that may require someone to be intubated. So Madonna may have had early signs where her lungs started to swell, and she required intubation. They may have checked her blood gas or oxygen levels, and they may have been low. But the unresponsiveness itself may have triggered the need for intubation. Whenever someone is unresponsive and we think that they are septic or systemically ill, we may protect the airway by intubating them. So these are some of the clinical signs. A loss of protein in the blood, as I mentioned before. So, and swelling also as a result of this. Now, here is an image of a chest x-ray. This is the silhouette part of the heart. And you see all this frothiness here. This frothiness is abnormal. This area should be all black. It's not. And so this is where you see swelling in the lung. And this is the early signs of ARDS. This person may be having difficulty with ventilation and oxygenation. And you can see right here, there's an endotracheal tube right in there. So this is a person in the ICU who's intubated. And intubation is simply when you take a tube down into the throat, into the airway rather, and you force air into the lungs to ventilate when the patient may be too fatigued to do so, or the lungs are too swollen or inflamed to oxygenate very well. Sepsis is a little mnemonic here, but I show this to show you the progression. Someone can start off very ill in bed. They get chills, get very sick, headache, the condition is worsening. They're calling for medical attention. They become unresponsive. Also, the airway may be compromised, or the ventilation may be compromised, such they may require resuscitation there. So again, a simple bacterial infection can progress to sepsis. A simple viral infection can progress to sepsis. We all remember having loved ones with viral infections. Start with COVID infection. The next thing you know, their lungs are filled up with fluid, and they're on a ventilator, or they're very sick in the hospital. So sepsis syndrome can contribute to a lot of these things, or increased clotting factors that can happen to anyone with sepsis syndrome. So how do you protect yourself from a severe infection? It goes back to a lot of the things I've said before. If you have a healthy immune system, will decrease the chance of a local infection breaking into systemic infection. So, for instance, if you're out jogging or riding your bicycle, you may have an injury to your arm. You break the skin, it gets a small infection. Well, if your immune system is healthy, that infection is kept intact, so it's less likely to break off and go into your bloodstream and cause a systemic infection. Similarly, if you injure your foot, etc. That's why diabetics, for instance, have a risk of amputation, because a local infection can develop locally, but it can also put them at risk for a systemic infection. So they can develop gangrene locally, which can also put them at risk of systemic infection, which would potentiate the need for amputation for a simple, foot wound that gets out of hand. So, what can you do to enhance your immune system? Well, be at a healthy weight, be physically active. Exercise improves the mitochondrial effects, and it helps the immune system. Eating healthy, a healthy diet, healthy plant-based diet with fruits, vegetables, whole grain. Eliminate fast foods. If fast foods increase oxidative stress, if you remember from some other talks, and that suppresses the immune system, it also may put the immune system in disarray. So you get a mild infection, the immune system may overreact and more rapidly put you at risk for sepsis. You want to eliminate red or processed meats, sugars, drinks. Eliminate alcohol consumption. Also you may use supplements, but make sure you use quality supplements. For mothers who have children, breastfeeding your baby is a benefit to enhancing their immune system, because it enhances their microbiome, and it's a very good way to start your children off to a healthy way of living. So again, I want you to stay well. Take care of yourself. I hope this information has been helpful to you. Again, if you're new to the station, give us a thumbs up, and also share with your friends and loved ones. Until next time, be well. And